Hello dear enthusiastic learners. Welcome to the 8th module of the Swayam MOOC course on Geography of Health and Well-being. Today, we shall delve into the nexus of development, environment and health. This module will enable you to understand what is development and how, through human history, various milestones in human development such as agricultural revolution, industrialization, urbanization, globalization, medical revolution have influenced human health. Development is a process of change. For some, it is a process and for others, it is an end. While development is a positive change, its counterpart growth can be both positive and negative. Development is generally confused with economic growth measured solely in terms of increase of annual income or GNP regardless of distribution. Development theory for a long time was dominated by experience of Western economic history. The emergence of capitalism and the advance of industrial revolution gave a distinctive form to Western development thinking. It is a process of structural societal change, for example, from rural agricultural society to urban industrial based society. This means that development would then involve changes in socio-economic structures including ownership, organization of production, technology, institutional structures and laws. Modernization theory defines development as the process of economic growth and technological advancement that would lead to modernization of the society. The dependence theory saw development as a process in which developing countries are dependent on the developed countries for resources. The human development approach emphasized on social and political factors in development including education, healthcare, gender equality to achieve human well-being and capabilities. To meet the needs of the present population without compromising the needs for the future generations. The post-development approach calls for alternative means to achieve well-being rather than aping the ideas of the global north. Throughout the history, the key events that have shaped the development across the nations are agricultural revolution, industrial revolution and urbanization. All these have significant impact on environmental health and human health. Impacts of agricultural revolution. Agricultural revolution was a major shift in the lifestyle of human beings. Until human beings did not tame fire, life was nomadic, dependent on hunting and gathering. The knowledge of cultivation and use of fire led to the cultivation of crops and domestication of animals that led to the rise in settled civilization and development of sophisticated labor. This major economic shift took place around 10,000 BCE. Over time, the surplus agricultural production meant food security and hence a lot of extra time was left to pursue other activities. Eventually, it became a driving force for division of labor, creation of markets, and beginning of urbanization. The ability to produce more food led to population growth, which in turn encouraged people to develop better ways of producing and distributing goods. The agricultural revolution affected health in numerous ways. Food availability and nutrition. It led to availability of variety of food essential for balanced diet even during the phases of famine and droughts. Increased crop yield and modern farming practices made food accessible, affordable, and thereby reducing malnutrition and improving daily calorie intake. On the other hand, agricultural revolution led to increased access to healthcare by creating jobs and generating income in rural areas. But on the flip side, due to the green revolution that was accompanied with HYV seeds, NPK fertilizers, pesticides and mechanization led to soil pollution and negative effects on human health. The increased use of chemical fertilizers and pesticides led to soil degradation in areas used for monoculture. This soil degradation further reduced soil fertility, increased erosion and soil acidity. The initial impetus in production led to food security, but in the long term, polluted soil and water causing diseases like cholera, typhoid, dysentery and cancer were prevalent. The Green Revolution relied heavily on water irrigation system, which led to depletion of water resources. Water scarcity in the long run may lead to food shortage. The practice of monoculture aimed at increasing crop yield compromised the region's biodiversity and diminished traditional varieties of crop. Excessive use of chemicals and fertilizers can lead to eutrophication, make pests immune to these chemicals, enter the food chain and ultimately cause environmental and health impacts pertaining to liver, kidney and stomach. Common diseases due to agricultural activities include tick-borne disease, skin disorders, zoonotic diseases like bird flu, and poisoning due to pesticide pollution. Impacts of Industrial Revolution. This is the stage of mass production characterized by development of new industries, strides in transportation efficiency, communication, including telegraphs and telephones, and energy production from coal and oil led to industrial revolution. This led to increased employment and better standard of living, mass consumption, that further transformed the environment we live in. This period witnessed baby boom and improved medical facilities that increased life expectancies and survival rate of infants. On the contrary, it also created new challenges and risks. Some positive impacts of Industrial Revolution on human health are improved medical technology. The Industrial Revolution spurred advancement in medical technology, leading to better diagnostic tools, treatments, and surgical procedures. Some key inventions during this time include X-ray machines, ultrasound machines, polio vaccine, penicillin, insulin, MRI, pacemaker, and a number of antibiotics. It also led to increased availability of medications. Mass production techniques allowed for widespread availability of medicines, making treatments more accessible and affordable. Enhanced sanitation. The development of modern plumbing and sewage system reduced the prevalence of waterborne diseases and improved overall public health. Better nutrition. Advances in agriculture and food processing improved the availability and variety of food, leading to better nutrition and health outcomes. Improved living standard. Economic growth from industrialization raised living standard for many, providing better housing, cleaner environments, and improved access to health care. The understanding of hygiene led to improved sanitization and upgradation or setting up of robust sewage system, leading to decline in infectious diseases. Improved working conditions. Although industrialization exposed the workers to various kinds of new threats such as fire, fall, injury, etc., the countries also came up with acts and laws to protect and address the labor issues. United Kingdom implemented the Factories Act in 1933, followed by Factories Act in India introduced in 1948. The International Labour Organization is the only tripartite United Nations agency since 1919. It brings together the government, employers, and workers of 187 member states to set labour standards and develop policies, devise programs, and promote decent work for all women and men. Public health initiatives. Medical and sanitary revolutions highlighted the role of our environment in maintaining good health. The era saw the establishment of public health systems and regulations, including vaccination programs, health inspections, which helped control the spread of infectious diseases. Some of the negative impacts of industrial revolution of health include poor working conditions. Many industrial workers faced long hours, low wages, and hazardous conditions in factories, leading to injuries, respiratory issues, and health problems. Child labor. The widespread use of child labor in dangerous environments exposed children to significant health risk and stunted their physical and mental development. Urban overcrowding. Rapid urbanization led to overcrowded cities with inadequate housing, poor sanitation, and limited access to clean water, contributing to the spread of infectious diseases. Air pollution. The increase in coal burning and industrial emissions resulted in significant rise in air pollution. The Great London Smog is a famous incident that lasted for 5 days from December 5 to December 9 in 1952. The smoke and fog brought London to a standstill and resulted over 4,000 deaths in 5 days. Visibility was so impaired in some parts of London that the pedestrians were unable to see their own feet. There was spike in deaths and hospitalizations relating to pneumonia and bronchitis, and herds of cattle in Smithfield reportedly choked to death. Its consequences prompted Parliament to pass the Clean Air Act 4 years later, which marked a turning point in the history of environmentalism. Water pollution. Industrial waste and untreated sewage contaminated rivers and water supplies, leading to waterborne diseases due to poisoning by lead, heavy metals, chemicals, and other hazardous material. Noise pollution. The rise of factories and machinery led to increased noise pollution, which can cause stress, hearing loss, and other health problems. Stress, mental health. The demanding and monotonous nature of industrial work, coupled with harsh living conditions, contributed to stress and mental health issues among workers. Other significant health challenges were occupational health hazards, especially in the mining industry, malnutrition and deficiencies due to loss of traditional crops. The next important development that changed the face of planet Earth is the information technology revolution. Information technology is characterized by use of digital technologies and internet. It made communication faster than ever before, integrating the world in unimaginable manner. Although abacus is the first known calculating device, the first computer was invented by Charles Babbage in 1822. However, the modern computer was made public for the first time at the New York World's Fair in 1964. Information technology facilitates healthcare providers to collect, store, retrieve, and transfer information electronically. It helps maintain past health records and patient portals to personal health devices and apps. The positive impacts of information technology on human health include access to health information. It enabled easy access to vast amount of health information, empowering individuals to make informed health decisions and manage their health better. Telemedicine. Information technology enables remote consultations, allowing patients to receive medical advice and treatment from anywhere, which is especially beneficial for those living in remote areas. Electronic health records. Electronic health records streamline the management of patient information by improving the efficiency and accuracy of healthcare delivery. Health monitoring apps. Wearable devices and health apps help individuals monitor their physical activity, heart rate, sleep patterns, and other health metrics, promoting proactive health management. Medical research. Information technology accelerates medical research by enabling the collection, analysis, and sharing of large datasets, leading to faster advancement in medical knowledge and treatment options. Patient support networks. Online platforms provide support networks where patients can connect with others facing similar health issues, offering emotional support and practical advice. The information technology has brought about e-commerce websites facilitating online consultations, booking tests, and providing other health-related services online. Information technology has transformed the life of human beings in a dramatic way. The hunter-gatherers of the past and sedentary workers of the modern world contributing to obesity, cardiovascular diseases, and other health problems. Another impact of this revolution is increase in the screen time, which can cause digital eye strain, headache, and discomfort, as well as contribute to the vision problems like myopia. Mental health issues. The internet can create avenues for cyberbullying, stress, anxiety, depression, and issues with self-esteem, especially among young people. Sleep disruption. The blue light emitted by a screen can interfere with the sleep pattern, leading to sleep disorders and overall poor sleep quality. Easy access to health information online can lead to self-diagnosis and anxiety over health conditions. Data privacy concerns. The digitalization of health records and personal health information can lead to privacy breaches and unauthorized access to sensitive data. Urbanization is another landmark in the history of our planet Earth, which is related to development. Urbanization is the process of becoming urban, either from rural to urban or from smaller urban areas to growing into larger ones. Although urbanization is considered as one of the key parameters for development, it is not devoid of negative effects. However, the positive side of urbanization is that it has improved the healthcare access. Urban areas often have more hospitals, clinics, and healthcare professionals, providing better access to medical services and emergency care. It has enhanced public health infrastructure. Cities usually have better sanitation, waste management system, and clean water supply, which contribute to overall improved health. Health education and awareness. Urban settings offer more opportunities for public health campaigns and health education, raising awareness about preventive measures and healthy lifestyles. Economic opportunities. Greater economic opportunities in cities can lead to higher income, better standard of living, and the ability to afford healthier food, better housing, and healthcare. Advanced medical research. Urban centers are often home to universities and research institutions, fostering advancement in medical research and healthcare innovations. Urban areas have greater number of supermarkets where a wide variety of food items are available. There is easier access to fresh produce, organic food, and home delivery has eased with this access. The urban municipal services for drinking water, sanitation and sewage are better. Facilities including fuel, electricity and others have improved the standard of living, provided safe places of stay and improved health. On the contrary, urbanization has led to overcrowding, increased density of population that puts stress on the resources. As a result, the negative consequences of living in an urban area include exposure to higher levels of industrial and vehicular emissions that can lead to respiratory problems and cardiovascular diseases. Overcrowding. High population densities can result in overcrowded living conditions, increasing the spread of infectious diseases and reducing the overall quality of life. Stress and mental health. The fast-paced urban lifestyle, noise pollution, and high cost of living can contribute to stress, anxiety, depression, and other mental health problems. Lifestyle diseases. Urban residents often lead sedentary lifestyles with poor dietary habits, contributing to lifestyle diseases such as obesity, diabetes, and hypertension. Inequality with respect to access to resources. Despite the availability of healthcare facilities, there can be significant inequalities in access to healthcare services, with low income group residents facing barriers to quality of healthcare. Crime and safety concerns. Urban areas are hotspots of high crime rates affecting both physical and mental health. Traffic accidents. There is a higher risk of road accidents leading to injuries and fatalities in metropolitan cities. Life of all urban dwellers is not the same. People living in slums and squatter settlements, including informal laborers, migrants, construction workers, and even those working in decent jobs but due to high land rent, live in slums, are exposed to unsafe environments. This, accompanied with poverty, is a trap they seldom overcome. Most of the urban areas of Global South have high rise buildings, but beside them is a huge expanse of slums. This is not the case with Global North or the developed countries, although poverty in rural areas exists there also. Urbanization in the Global South is a missed opportunity due to unplanned and haphazard urbanization, overcrowding, economic and social inequalities. Associated with the process of urbanization is globalization that fosters interdependence between world economies, cultures, and populations. It led to outsourcing of jobs, sharing ideas and technology, evolution of new markets, and trade. While globalization facilitated medical innovations, treatments, and technology enhancing healthcare quality, monitoring and surveillance of diseases is also considered as a cause for spread of infectious diseases such as SARS that originated in the US, Zika virus that originated in Brazil, and the COVID-19 pandemic that actually spread from China to the whole world in a short span of time. Globalization has stimulated the process of urbanization, leading to proliferation of global trade and markets, whereby the local resources are used by global players, leading to environmental degradation and pollution. Global trade contributes to greenhouse gas emissions and significantly impacts the biodiversity. It has allowed society to enjoy many benefits, including increased global cooperation, reduced risk of global conflicts, and lower prices for goods and commodities. Unfortunately, it's also led to serious negative impact on environment and human health. Since there is no turning back, one may look at the brighter side and try to find ways to overcome the unwanted impact of development. This is possible through responsible management, sustainable management, that is, think before action. Rather, rethink again about the alternative paths that are sustainable and healthy. As development is essential for good health, but this development must sustain the health of the planet and not only the Homo sapiens. Envisioning this idea is the Sustainable Development Goal 3 on good health and well-being that aims to ensure healthy lives and promote well-being for all at all ages. Achieving Sustainable Development Goal 3 will depend on the progress in other Sustainable Development Goals, that is, poverty reduction, education, nutrition, gender equality, clean water and sanitation, sustainable energy, and safe cities. In fact, all the other 16 goals of SDGs are indirectly related to achieving good health. Even the G20 summit held in Delhi in 2023 declared One Health, One Family and One Future as its motto, highlighting the importance of all life, human, animal, plant and microorganisms, as well as their interdependence on Earth and across the universe. With this, we tried to uncover the reasons that make health dynamic and complex. We shall deal with some of these key drivers and their impacts in detail in the later modules. Till then, wish you good health and well-being. Thank you.